Okay, hello. My name is Tina Ella Holiday. I'm an audiology student at Gallaudet University, and I am giving a presentation on American Sign Language and cochlear implants, and how they are viewed by the deaf community, and as well as how ASL is really important to audiologists as well. So I wanted to start by explaining what a cochlear implant is. Um, it is used as a tool to help individuals with severe to profound hearing loss have access to sound in their environment. So it consists of an outer portion with a microphone that picks up sound from the environment, and that sits on the ear. And then it also has an inner portion that is inserted into the cochlea, which is our hearing organ. It's that snail shell looking piece in the diagram to the right. And it's a device that directly stimulates the nerve pathway for hearing for auditory information to the brain. It is used as a listening tool and can also be used for speech understanding. I will emphasize this throughout the presentation, that it is solely a tool and it does not make the sound experience the same as it would be for a person who has normal hearing. And I want to emphasize that because it's really important to remember that a cochlear implant does not make an individual hearing. They're still experiencing a hearing loss. So previously, the deaf perspective was that cochlear implants are okay for individuals who lose their hearing later in life because they have a spoken language background, and that's what they were raised with. However, cochlear implants by the deaf community were considered very controversial in deaf children because children were not given a choice, and many hearing parents were making that decision for them. And the deaf community very much views deafness as a cultural identity rather than an impairment that needs to be fixed. Today, the deaf perspective is not as much looking at a child having cochlear implants versus a child being raised with American Sign Language. You see cochlear implants and American Sign Language coexisting a lot more than in the past. And even with improved technology, the debate has really changed over from cochlear implants versus ASL to are we making sure the individual has visual support, whether or not they have a cochlear implant. This is the position statement of the National Association of the Deaf on cochlear implants, and it says that the National Association of the Deaf has always and continues to support and endorse innovative educational programming for deaf children, implanted or not. Such programming should actively support the auditory and speech skills of children in a dynamic and interactive visual environment that utilizes sign language and English. So basically, what they are saying is that it doesn't matter whether or not the child is implanted. It's really important that the child has access to language skills, whether that consists of American Sign Language or English, but that the child is getting visual support. So I think this is really important as a future audiologist because most deaf children are born to hearing families, and a lot of hearing families don't necessarily have a background of understanding for what a cochlear implant can do for a child, or the different options that they have to move forward once they find out that their child is deaf. So I think it's really important that audiologists emphasize visual support and American Sign Language for deaf and hard of hearing children, regardless of whether or not the child has an implant, because again, having a cochlear implant, that is very much a tool and it does not make the person hearing. And most individuals with cochlear implants will still experience hearing and understanding difficulties with spoken language. And so it's really important that we're giving them, especially children who are learning language, visual access so that they have the most possible resources to use for learning language. The other thing too is that having a cochlear implant is a choice. Often this choice is made by the child's family rather than the child themselves. But even for the family, it's not always the best choice for every deaf person. The outcomes of having a cochlear implant are very different for different individuals. And for some people, depending on their values and their life circumstances, it's not necessarily the best choice. And so as audiologists, we need to support that and still lead families and children towards other resources that will give them the best language access outcomes. Continuing with that, it's really important that we provide this during appointments. I think as audiologists, we want to guide families toward the most resources, toward people that and services that will give them access, but very frequently we're not providing that access during the appointments. And I think whether or not the individual uses American Sign Language, there are things we can do, such as providing live captioning during the appointment so that we can make sure the individual understands what we're saying. We can provide sign language interpreters during appointments, or if the audiologist is competent in using American Sign Language directly with the client during the appointment, then using that and being flexible with different families and different needs. Information in these slides is taken from the Cochlear Implants panel on the second floor of the Sorensen building on Gallaudet University's campus. I've attached a photo here for you in case you would like to give that a read. Thank you for watching.